Diabetes is now the fastest growing chronic condition worldwide, with over 500 million people currently suffering from the illness. And with the new risk of type 2 diabetes in children, the need for a nationally funded prevention plan has reached an all-time high.
Now, according to professionals, there are ways to prevent and also treat the debilitating disease without using medication.
For more, we welcome nutritionist and dietitian Dr. Sue Radd. Welcome to you, Sue.
Good morning.
Okay, so this is really interesting because you've written a brand new book about medicine foods that can help. Really, well, you talk about going into remission from
Remission
diabetes.
is actually possible for some cases of type 2 diabetes, not type 1. But in those cases, you need to get in early, and most people need to lose about 15 kilos of weight and keep it off. So we now know remission is possible. 30 years ago, this was not a possibility. You thought, you know, if you got diabetes, it was your destiny. But, you know, even if you can't go into remission, it's really, really important to control your blood glucose tightly and well, because there are a lot of complications, and if you don't control your glucose, it can cut your life short by about 10 years, diabetes. But also there are complications such as preventable amputations below knee, above knee. There's a double risk of dementia if you have diabetes, high risks of heart attack. I mean, the list goes on. Kidney failure, but this is mostly all preventable. So that's the good news. People have a lot more control on their plate than they realise.
Doctor, what's your position on people, I don't know if relying is the right word, but using drugs like Ozempic to treat diabetes?
So some of those drugs or even surgery can be helpful, maybe initially to give someone a boost. But the problem is a lot of people don't tolerate drugs or can't afford them. And you can't stay on them for the rest of your life. So you need a lifestyle approach that is combining that medication approach, you know, with how you live, because you're going to come off the drugs sooner or later, even if you can get them and tolerate them.
Okay, so let's talk about what that looks like, because for anybody, particularly with a new diagnosis of diabetes, just getting your head around it, it is completely overwhelming. Life stops, from what I can see. So what are some of the foods that you would recommend? Because I imagine that it needs to be not too difficult to actually implement.
Exactly. So we want lots of colour. We want a lot more plant foods on the plate compared to what Aussies are eating at the moment. So we're all lacking in vegetables, in fruits, in nuts, in seeds, and in particular in foods called legumes. They're the dried beans, peas and lentils. Legumes have a plant protein, which is very powerful to reduce the risk of diabetes in the first place. They're also loaded in fibre, dietary fibre, which feeds the good bacteria in the gut. So we need more colour and more plant foods on our plate. At the moment in Australia, people are eating double the protein that is recommended and half the dietary fibre, and this is a problem. So if we don't fix things, you know, nothing's going to change.
So what are the foods you definitely don't want to see on the plate, Doctor?
Well, we need to remove or reduce what we are now calling in research ultra-processed foods. They're the same old culprits that we've always called junk food, but they include foods like sugary drinks, sugary foods, processed meats. You know, if you have, say, ham 5 days a week on your sandwiches each week, it raises your risk of type 2 diabetes by about 90%.
Wow.
So highly,
amazing, isn't it?
highly processed foods really need to be pushed off the plate. But, you know, things like packet crisps and biscuits, all those things made for you have a very harmful effect because of how they rapidly affect your blood glucose and insulin levels.
Well, as we mentioned at the head, you've got a new book out. It's called Food as Medicine, Cooking to Prevent and Treat Diabetes. That is out now, and you can find a lot more about it in Dr. Sue's brand new book. Thank you so much for coming in.
Thank you.
We really appreciate it.
Thank you.
Thank you, sir.